Hi everyone, this is Veronica. Today we are going to talk about very important topic, that is Fourth Global Digital Health Partnership Summit. So what are the details of this summit? We'll discuss in detail. For my video updates, you can follow me on Instagram and Facebook. The PDF of this lecture will be uploaded on our website. This is a channel Study IQ. If you're preparing for any government exam, our pen drive and tablet courses are also available. Here on the screen, you can see the list of courses we have. If you wish to have any additional information about these courses, you can call on our numbers or you can visit our website too. The PDF will be available in both the languages, Hindi and English. Now, what is the relevance of this topic from the exam point of view? If we talk from the UPSC perspective, it will be covered under your mains paper 2 governance under these topics, and at objective level, you should know the details, the features of the summit, why it happened, and then why there is a need of EHR in India. EHR is Electronic Health Record. Okay, so now let's move forward. Why it is in news? Because Union Health Ministry, they have inaugurated the 4th Global Digital Health Partnership Summit in New Delhi, right? That is why. So we should know why this summit happened, what are the details. So let's talk about the details. Now, this summit is a global intergovernmental meeting on digital health. And this is hosted by Ministry of Health and Family Welfare. So this is hosted by Ministry of Health and Family Welfare in collaboration with World Health Organization and GDHP. So GDHP is your Global Digital Health Partnership, right? So in this conclave, they discussed various implications of digital health interventions to health services, accessibility. So here 3 things are important. One is accessibility. Second is quality. Third is affordability. And therefore, they will explore ways of leveraging digital health technologies to strengthen the healthcare delivery systems globally. So this summit, when obviously so many governments and government agencies are involved, it is intergovernmental. So we are talking globally here that how we can improve the health system deliveries in different countries globally with the help of digital technology, how we can improve the delivery systems. Now we need to talk about electronic health record in India. That this is very important. So here we are talking specifically about India, because India has embraced digital health to achieve the targets of universal health coverage, that the health service should be available and affordable for all the citizens, to all the citizens. Now a National Resource Center for EHR standards has also been set up in order to augment facilitation for adoption of notified EHR standards. And even India government, they have notified the health informatics standards and they have approved metadata and data standard for enabling seamless exchange of information across the care providers. So this is very important. See, usually when you go to a doctor, you have your file with you with all the papers in it, which the papers, especially the prescriptions, the various tests you have undergone, whether they are the X-ray tests, the ultrasounds, the MRI reports, or whatever. So whenever you change the doctor, you change the hospital, you change the country, you change the city for your health services, right? You have to tell your story, you have to give your medical history from the scratch, right? But if such a system is there, electronic health record, so the doctor will just log in into it, he or she will see your records, and they will have a conclusion with them, like what is needed to be done with this patient, at which stage it is, what medicines are required, what further prescriptions are required. It makes the delivery system easy for the patients globally, right? So this is the benefit of electronic health record. So here we are talking in respect with India that it is very necessary, because it aims to make these systems interoperable also, and to build electronic health records of citizens. And even for India, it is important because India took world stage at the 71st World Health Assembly in Geneva, Switzerland, by successfully introducing and unanimous adoption of resolution on digital health, that India said that yes, now we will move forward towards digital health in our country. So now this is all about digital health, but here we are talking about Global Digital Health Partnership. So we'll talk about this summit in detail, like what is this organization, GDHP. See, the Global Digital Health Partnership is a international collaboration. So in international collaboration, who are involved? The various governments, government agencies, and then multinational organizations. Right? So it is dedicated to improving the health and well-being of the citizens through the best use of evidence-based digital technology. So here I am using the word evidence-based. So it is not like this that they will bring any one or two technologies in the digital system and in the health system and they will say we will use it. It should have some evidence that this technology is needed or it is giving results. So governments are making significant investments to harness the power of technology, right, and foster innovation, and public-private partnerships also getting boosts that support high quality, sustainable health and care for all. And now the GDHP facilitates global collaboration and cooperation in the implementation of digital health services. Now see which are the member countries of GDHP. There are around 23 countries, so you need not to remember all the names, but you should know that India is part of it. Switzerland, Sweden, Portugal, New Zealand, Japan, Hong Kong, Australia, Argentina. So these, United States and United Kingdom also, and World Health Organization also is a part of GDHP, and they have 5 work streams of GDHP. Number 1 is cyber security. This is important because everything is digital, so you have to maintain the cyber security. Next is evidence and evolution. As I told you, whatever technologies they want to bring in, they should have a proper evidence and then analysis and evaluation of that system. Then policy environments are very important. Then interoperability, as I told you, that whatever technology, it should be operable within the countries, around the boundaries and international boundaries also. And last is clinical engagement, clinical and consumer engagement. So this is the main 5 functions of GDHP, and 23 countries are member of GDHP. So one more thing, what is important here, why is GDHP important for populations globally? So for that, you need to understand that as countries around the world, they are facing challenges of designing systems and delivery systems also, and delivery services that result in good health and well-being of their citizens. Now digital technologies can provide potential solutions. They can improve the safety, quality and effectiveness of healthcare. They can support earlier diagnosis of disease and development of new medicines and treatments. They can empower patients, citizens and the care professionals who serve them. So that is why governments are making significant investments to harness this power of technology and foster innovation and public-private partnerships also. And then there is a collaboration and cooperation in the implementation of digital health services, but there is currently no similar international forum to share best practice and enable co-working in digital health as this GDHP is doing. So that is why it is very important for the populations globally. So this is about this lecture. If you have any queries, you can contact me. Thank you.